Gender dysphoria is a condition where a person's physical, biological sex is one, say a boy, but in the person's mind they think they're really a girl or vice versa. It's not something that you can identify on any objective test. You can't do a blood test, for example. You can't do MRI imaging. You can't do genetic testing to actually find this gender identity. My name is Dr. Michael Laidlaw. I'm an endocrinologist in Rocklin, California. This gender identity, which is really a child saying, I believe I'm this, I believe I'm a boy, I believe I'm a girl, something opposite of their body. Once they say that, they go down this road of gender affirmative therapy. That consists of social transition, wearing, say, stereotypical clothes of the opposite sex to pretend that they're the opposite sex, then these puberty blockers, then these cross-sex hormones, and then finally surgical modifications to the body to try to make the person appear that they're the opposite sex. Puberty blockers are powerful hormones. They act on a small gland in the brain called the pituitary, and this controls the sex organs. For example, testicles make testosterone, ovaries make estrogen, and the pituitary controls that happening. Now, these blockers stop this action, and then whereas, say, a girl is in age 9 and continuing or beginning to develop in puberty and should continue on until a full adult woman, it's stopped. Once you stop it, there are various harms and problems that occur afterwards. Unfortunately, many of our professional organizations are advocating for this, including Endocrine Society. And it's important to bear in mind that there's very small groups of people controlling these societies. Small groups of people are making these pronouncements, and then when physicians want to turn to what's the best practice, they're finding these things. And there's no rigorous research done. There's no controlled studies. It's very poor research, but it's, I guess, politically correct to go down these roads by these organizations. Doctors will feel compelled to follow what their organization says without really looking into the evidence necessarily. There is heavy-duty propaganda basically going on, but these gender clinics have sprung up and have multiplied all across the country. The numbers are going up around the world, in the UK, Canada, here, other places. More and more kids are being diagnosed with this, and there's a social contagion component. Kids going on to YouTube, Tumblr, things like that. So the cases are rising. It's a major problem that we have to address. In my practice as a physician, I always look at side effects of medications before I give anything to anyone. Say for diabetics, I always tell them, if you can work on your diet and exercise first, I'd rather have you do that than take these medications, because there's side effects and there's problems that are potential. But if you need it, then you need to take it. With this, I can see no need to take these medications. I see the risks as being very high, and I see children as a very vulnerable population, can't speak up for themselves, and their parents are often propagandized by this movement. I've met a lot of these parents. My heart goes out to them. I've seen their kids and pictures of the kids, and really, it's about helping kids.